Welcome back, everyone. We're diving into a topic today that I know a lot of you have been requesting, and to be honest, I'm pretty excited to tackle it myself. We're talking about psychiatric medications.
Definitely a crucial area, especially for therapists these days.
Absolutely. So we're going deep with Chapter 4, Pharmacology. It's from the Handbook of Clinical Psychopharmacology for Therapists. Ninth edition, by the way. I got to say, this chapter is dense.
It is, but super important, right? I mean, understanding how these medications actually work, it's becoming more and more essential for therapists, especially as we see these collaborative care models becoming more common.
Collaborative care working alongside psychiatrists and other prescribers, I think that's a great point to highlight. It's like we're all part of a team, and understanding the medications our clients are taking helps us be better team player, right?
Exactly. We can communicate more effectively, understand potential challenges, and really support our clients in a more holistic way.
Okay, so let's dive into the nitty-gritty of pharmacology. Where does this chapter even begin?
Well, it starts with the basics, which is pharmacokinetics, basically what happens to a drug once it enters the body. Think of it as a journey with four main stops: absorption, distribution, metabolism, and excretion.
Pharmacokinetics, okay. A journey through the body? I like that visual. So let's break it down. Absorption, that's the first stop, right? What happens there?
Think about it like this. When you take a medication, let's say a pill, it has to make its way into your bloodstream. It's got to get absorbed.
Right, like it can't just magically teleport to where it needs to go, right?
Exactly. It's a process. It starts in the digestive system, the pill dissolves, and then the medication gets absorbed through the walls of the stomach or intestines into the bloodstream, like a little submarine navigating its way through your insides.
So the medication is on a mission, heading towards its target. And I'm assuming the target, in most cases, is the brain, right?
You got it, but there's a challenge, the blood-brain barrier.
Oh yeah, I've heard of that. It's like a super selective bouncer guarding the engines to the brain, right?
Exactly. It's designed to protect the brain from harmful substances, but it can also make it tricky to get medications where they need to be. Not all drugs can cross that barrier.
Which is why some medications are designed specifically to target the brain, while others work elsewhere in the body. It's fascinating how they figure that stuff out.
It really is, and the chapter highlights this with Case 8, Patricia. She was having memory issues after cancer treatment, and it turned out the chemo drugs she was taking didn't actually cross the blood-brain barrier, so they weren't causing the typical cognitive side effects.
So that barrier really plays a crucial role in determining which medications can affect the brain and which ones can't. That's wild.
It is, and once a drug manages to pass that checkpoint, the next stage is distribution, how it spreads throughout the body.
Okay, so it's made it past the bouncer, now it's got to get where it's going, is that right?
Yep, think of it like a delivery truck, carrying the medication to different tissues and organs.
So it's not just a straight shot to the brain, even if that's the ultimate destination.
Right, some medications get stored in certain tissues, acting like reservoirs, like a storage unit for meds, basically.
Interesting. Why would the body store medication like that?
Well, it's part of how the body regulates drug levels over time. It's all about maintaining a balance. And this can get tricky sometimes, especially with factors like body composition. The chapter talks about Helen. In Case 9, she was taking the antidepressant desipramine, and because she was obese, a significant portion of the drug was actually getting stored in her fat tissue.
So her body was essentially holding on to the medication, making it less available to actually do its job in the brain.
Exactly. It highlights how individual factors can play a big role in how a medication affects someone.
That's incredible. Okay, so the medication's been absorbed, it's been distributed, it's reached its target, or at least part of it has. What happens next? Does it just stay in the body forever?
Nope. The body is remarkably efficient at breaking down and eliminating medications, and that's where metabolism comes in, the third stop on our pharmacokinetic journey. Think of your liver as a processing plant, transforming the drug into metabolites.
Okay, so the liver's like the body's recycling center, breaking down those unwanted substances.
That's a great way to put it, but those metabolites aren't always just waste products. Sometimes they're actually responsible for the desired therapeutic effect.
Wait, so sometimes it's the broken down parts of the medication that are actually doing the heavy lifting.
Exactly. It's a complex process, and it varies depending on the medication. And sometimes those metabolites can contribute to those pesky side effects, too.
This reminds me of Susan and Caitlin from the chapter. They were both prescribed the same antidepressant, but had totally different responses. Susan had all these side effects, while Caitlin barely felt anything.
Those cases are great examples of how individual differences in metabolism can make a huge difference in someone's experience with medication. Susan might be what we call a slow metabolizer, her body processing the drug slowly, which can lead to a buildup and more side effects. Caitlin, on the other hand, might be an ultra-rapid metabolizer. Her body breaks down the drug so quickly that it's almost like she isn't taking anything.
Wow, so it's like a Goldilocks situation. You need the right amount of the medication, not too much, not too little, to really get the benefits without the unwanted side effects.
Exactly. And that's why it's so important for therapists to be aware of these individual variations. We can help our clients understand their own unique responses to medication and encourage open communication with their prescribers.
It's all about being informed and advocating for your own well-being, right? Okay, so we've talked about absorption, distribution, and metabolism. What's the final stop on this pharmacokinetic journey?
Excretion. This is how the body gets rid of the drug and its metabolites, primarily through the kidneys.
So the kidneys are like the body's filtration system, flushing out all those unwanted substances. Makes sense.
Exactly. And this is where the concept of half-life comes into play.
Okay, half-life. I've heard that term, but honestly, I'm not sure I fully understand it.
It's basically the time it takes for half of the medication to be eliminated from the body. It's important for determining how often someone needs to take a medication and how long it takes to reach a steady state.
Steady state. What's that?
It's like filling a bathtub with the drain open. Eventually, the water level stabilizes when the amount of water flowing in equals the amount flowing out. That's steady state, a balance between drug intake and elimination.
Okay, I get it now. So when you reach steady state, does that mean the medication is working its magic?
Not necessarily. Reaching steady state just means we've achieved a consistent level of the drug in the body. The actual therapeutic effects might take a bit longer to kick in.
I see. So it's not an instant fix, even when you've reached that steady state.
Right. It's all about patience and understanding that the body needs time to adjust and respond to the medication.
This is fascinating. I'm starting to see just how intricate this whole process is.
It really is a carefully choreographed dance between the drug and the body. And we've only just begun to explore the fascinating world of medication effects.
Okay, so we've covered how drugs move through the body, but what happens when they reach their destination? What are the actual effects, both the desired and the, well, sometimes not so desired?
That's where things get really interesting. Stay tuned, listeners, because we're about to dive into the world of medication effects, those intended outcomes and those sometimes unwelcome surprises. Welcome back to our deep dive, everyone. So before we jump into those side effects, I think it's important to understand the difference between the intended effects of a medication and those unintended, often undesirable consequences.
Right, yeah. It's easy to lump everything together when we talk about medication effects, but there's a distinction, isn't there?
Exactly. So the intended outcome, the reason we prescribe the medication in the first place, that's what we call the pharmacological effect. For instance, if someone is experiencing hallucinations, we might prescribe an antipsychotic medication. And the goal there would be to reduce those hallucinations. That reduction would be the desired pharmacological effect.
Okay, so the pharmacological effect is like the medicating's primary mission, its main objective. And then everything else, those unintended consequences, those are considered side effects.
Precisely. Side effects are those additional effects that occur alongside the intended therapeutic effect. They can range from mild things like dry mouth or drowsiness to more serious issues like weight gain or metabolic changes.
Right, those long lists of potential side effects in medication commercials. It can be pretty overwhelming sometimes. But here's a question I've been wondering about. Can side effects ever be a good thing?
That's a great question. And, sometimes the answer is yes. Depending on the individual and their specific needs, side effects can actually be beneficial. Let me give you an example. Let's say a patient is struggling with both anxiety and insomnia. Their doctor might prescribe an antidepressant that also has a sedating effect.
Ah, so the sedation, which is technically a side effect, could he actually help with the insomnia? It's like hitting two birds with one stone.
Exactly. You're addressing both the anxiety and the sleep issues with one medication. But of course, not all side effects are so welcome, right? And then there are those idiosyncratic effects. These are unpredictable and they vary from person to person.
Idiosyncratic effects, they sound kind of mysterious. What are some examples of that?
Well, allergic reactions are a prime example. That's when the body overreacts to a medication, treating it like a foreign invader. You might see anything from a mild skin rash to, in severe cases, anaphylaxis, which can be life-threatening.
Wow. Yeah, allergic reactions could be really serious. I've definitely heard stories about people having severe reactions to certain medications.
Right. And then another example is discontinuation syndrome. This happens when a medication is stopped abruptly and the body basically reacts negatively. It's like the body got used to the medication being there and then suddenly it's gone and it throws a tantrum.
So you might see a resurgence of the original symptoms or even some new unpleasant ones? That sounds pretty rough.
It can't be. This is particularly relevant with certain antidepressants and antipsychotics, and it highlights why it's so important to taper off medications slowly and under the guidance of a doctor.
Makes sense. Going cold turkey on certain medications can be a recipe for disaster.
Definitely. It's crucial to approach medication changes with caution and always involve the prescribing physician in those decisions.
Okay, so we've talked about how drugs move through the body, the different types of effects they can have, and even those unpredictable idiosyncratic effects. It's amazing how much we're still learning about how medications interact with our unique biology, isn't it?
It really is. There's always more to discover in pharmacology. Speaking of fascinating frontiers, let's talk about drug interactions. This is where things can get complicated, especially as more people are taking multiple medications these days.
Yeah, drug interactions, that's something I've always been curious about. Is it really as simple as those warnings on medication labels that say, don't take this with grapefruit juice?
Well, grapefruit juice is definitely a factor in some interactions, but it's just the tip of the iceberg. When you combine medications, they can affect each other in a lot of ways. One common interaction is called enzyme inhibition. That's where one drug basically hogs the metabolic pathway, preventing the other drug from being broken down properly.
So it's like there's a competition for resources in the body. One drug is hogging all the enzymes and the other drug is left stranded.
Yeah, that's a good way to visualize it. And because that second drug isn't being broken down efficiently, its levels in the bloodstream can increase, and that can lead to toxicity in some cases.
Toxicity, yikes. Are there any real-world examples of this happening?
Absolutely. The chapter mentions Eugene in case 13. He was taking an antidepressant along with a beta blocker for his high blood pressure, and the antidepressant actually ended up inhibiting the enzyme responsible for breaking down the beta blocker. This caused his blood pressure to drop dangerously low.
That's scary. It's a good reminder that drug interactions are a serious issue, not just about whether the medication is effective, but also about safety.
Exactly. We don't want those chemical reactions in the body to get out of control. That's why open communication with doctors and pharmacists is so important. They're trained to identify and manage these interactions to ensure both safety and treatment effectiveness.
Right, so therapists may not need to be experts in drug interactions, but it's definitely helpful to have at least a basic understanding.
I agree. As therapists, we're often in a good position to notice changes in our clients that might signal a potential problem. We can encourage them to talk to their doctor or pharmacist if something seems off.
Like we're an extra set of eyes and ears looking out for our clients' well-being. Okay, so we've talked about drug interactions. What about this thing called pharmacogenetics? I have to admit, this is a topic that really gets me excited.
Me too. This is where pharmacology meets genetics. It's the idea of personalized medicine, tailoring treatments to an individual's unique genetic makeup.
It's like having a custom-tailored suit for your brain chemistry. The idea that we could personalize medication based on your DNA is pretty mind-blowing.
It is, and it's becoming more and more of a reality. Pharmacogenetics helps us understand how variations in our genes can affect how we respond to medications, both in terms of effectiveness and side effects.
So our genes actually play a role in how our bodies process and react to drugs.
Absolutely. Remember those slow and ultra-rapid metabolizers we talked about? Well, those differences often come down to genetic variations in those enzymes that are responsible for metabolizing the drugs.
This is so cool. So theoretically, could pharmacogenetics help us avoid that whole trial and error process of trying different medications until we find one that works?
That's the hope. Imagine a future where a simple genetic test could guide medication selection, minimizing the risk of adverse reactions and maximizing the chances of finding the right treatment from the start.
That would be incredible. But is this kind of technology readily available right now? Could I go to my doctor and say, hey, I want a pharmacogenetic test?
Well, not quite yet. While the field is advancing rapidly, we're still not at the point where these tests are routinely used for most psychiatric medications.
I see. So what's holding pharmacogenetics back? It seems like it has so much potential.
It does, but there are some challenges. One is the sheer complexity of the human genome. It's not a simple one-to-one relationship between a gene and a drug response. It's more like a giant multidimensional puzzle.
So it's not as straightforward as saying this gene equals this drug response. Got it.
Right. And then there are the ethical considerations, things like data privacy, informed consent, and access to testing. All of those need to be addressed carefully.
Right. So there are a lot of layers to this, both scientific and ethical. It sounds like there's a lot of ongoing discussion and debate about how to best integrate pharmacogenetics into clinical practice.
Definitely. It's a rapidly evolving field that has the potential to completely revolutionize medication treatment. But for now, it's more of a glimpse into the future of personalized medicine.
A glimpse into the future. I like that. So we've gone from the big picture of genetics to those tiny chemical messengers in the brain. Now I'm curious, How do these medications actually work at the cellular level?
To understand that, we need to talk about neurons, those specialized cells that make up our nervous system. They're like tiny messengers that transmit signals throughout our brains and bodies.
Neurons, the building blocks of our thoughts and feelings and everything we do. It's amazing to think about how these microscopic cells can orchestrate such complex processes.
It really is. And on the surface of these neurons, we find receptors. They're like tiny docking stations where different molecules can bind.
So receptors are the key players here.
Exactly. They're like gatekeepers controlling what goes in and out of the neuron. And the molecules that bind to these receptors, like neurotransmitters, hormones, and even medications, those are called ligands.
Ligands. So what do those do?
Think of ligands as special guests at the neuron's party. They can either activate the receptor, like turning up the music and getting the party started. That's called an agonist effect. Or they can block the receptor, like a bouncer keeping unwanted guests out. That's called an antagonist effect.
I love that analogy. So agonists are like the life of the party, stimulating activity, and antagonists are the security guards, keeping things in check. Makes sense.
Exactly. So, for example, some antidepressants work by acting as agonists at serotonin receptors, increasing serotonin activity in the brain, like they're giving those serotonin receptors a little nudge to get things going.
So, in a way, the medication is mimicking the actions of those naturally occurring neurotransmitters, like serotonin.
Precisely. But here's where it gets a bit more complex. Many medications aren't perfectly selective, meaning they might bind to multiple types of receptors, not just the one we're targeting.
So it's like trying to hit a bullseye, but the arrow might stray and hit other targets as well.
Exactly. And that lack of selectivity, that's often the culprit behind those unwanted side effects we talked about earlier. The medication might be hitting its intended target, but it's also hitting other receptors along the way, causing those off-target effects.
So the quest for selectivity is about finding medications that are like precision instruments, targeting only the specific receptors involved in the condition we're trying to treat. Right?
Exactly. It's a major challenge in drug development, but a crucial one. The more selective a medication is, the fewer side effects it's likely to cause. The chapter talks about serotonin receptors, how there are actually many different subtypes of these receptors, and trying to create a drug that only targets a specific subtype without affecting the others. Well, it's a tough task. It's like designing a key that only fits one specific lock, even though there are many locks that look very similar.
Wow, that's a great way to visualize it. Finding that perfect key, that highly selective medication, that's the holy grail of pharmacology, I guess.
You could say that. It's an ongoing pursuit to create medications that are as precise and targeted as possible, minimizing those off-target effects and maximizing the therapeutic benefits. But even with the most selective medications, there's another factor that can make a huge difference in why treatment is successful, and that's medication adherence.
Medication adherence. I have a feeling this is something therapists encounter all the time in their work with clients.
You're absolutely right. It's a major challenge in mental health treatment. Medication adherence basically refers to how well patients take their medications as prescribed. And unfortunately, studies show that a large percentage of people with mental health conditions don't actually take their meds as directed.
That's concerning. I mean, you would think taking your medication as directed would be a pretty straightforward way to ensure treatment is working. Why do so many people struggle with medication adherence?
It's definitely more complex than it seems on the surface. The chapter talks about some of the work by psychiatrist Sean Shea, who done a lot of research on this topic. He points out several factors that contribute to this issue, and one of the most common is the lack of immediate improvement.
So people might get discouraged because they don't see results right away.
Exactly. A lot of psychiatric medications, particularly antidepressants, can take weeks or even months to reach their full effect. And that can be really frustrating for people who are eager to feel better, right? It's easy to lose motivation when you're not experiencing relief, even if you understand that it takes time for the medication to work.
That makes sense. When you're struggling, you want to feel better as soon as possible.
Absolutely. And then, of course, there are those side effects we discussed earlier. Unpleasant side effects can be a major barrier to sticking with the medication, even to the point where some people avoid treatment altogether.
Yeah, I can imagine. If the medication is making you feel worse before it makes you feel better, it can be really hard to stay motivated.
It's a balancing act, weighing the potential benefits of the medication against those potential downsides of side effects. Sometimes those side effects outweigh the benefits, and people decide to stop taking the medication.
So it's a very personal decision, weighing the pros and cons.
It is, and it's something that should always involve open and honest communication between the patient and their healthcare provider.
Absolutely. So lack of immediate improvement, side effects. What else contributes to medication non-adherence? You mentioned there were a few factors.
Another one is simply the practical challenge of remembering to take your medication, especially when you have a complicated dosing schedule.
Right, like juggling multiple medications with different dosages and timings. I could see how that would be easy to mess up.
It's definitely a common challenge. And even small deviations from the prescribed regimen can have an impact on treatment outcomes.
So consistency is key.
Absolutely. Taking your medication as prescribed, even when you're feeling better, is really crucial for maintaining stability and preventing those relapses.
This deep dive has been such an eye-opener. I'm realizing there's so much more to medication than just taking a pill. It's a complex interplay between the drug, the body, and even our own behaviors and beliefs.
You've hit the nail on the head. Understanding these complexities can empower both therapists and patients to work together more effectively. We can navigate those challenges together and maximize the potential benefits of psychiatric medications.
Welcome back, everyone. I got to say, after all that talk about neurons and receptors, my brain's feeling a bit overloaded, but in a good way, you know?
Yeah, it's a lot to take in, for sure. But hey, even scratching the surface of this topic can change how we talk with our clients about their medications, right?
Totally. I'm already feeling more comfortable thinking about these issues. So as we wrap up our deep dive here, any final takeaways you want to leave our listeners with? What are the most important things to remember about psychiatric meds?
Well, we covered a lot of technical stuff, but I think the biggest thing to remember is that these medications, they're powerful tools, but they're not magic. I mean, how well they work, it really depends on a ton of factors, from the person's biology and genetics to their lifestyle and even their beliefs about medication.
Right. So each person's experience with medication is going to be different.
Exactly. And that's where, as therapists, I think we have a big role to play. We can help our clients understand their options, advocate for themselves, and really be in the driver's seat when it comes to making decisions about their treatment.
Makes sense. And I guess that highlights the importance of collaboration, right, between therapists and the prescribers. It's not about one person have all the answers, but really working together as a team.
100%. Open communication and, a shared understanding of all the complexities of medication, that's key for good collaborative care.
Okay, so before we wrap up completely, is there a final thought or question that you want to leave our listeners with? Something that maybe we didn't fully address, but might spark some further reflection for them.
Ooh, okay. Well, one thing I was thinking about is how stigma, society stigma really impacts how people use and view these medications. We talked a lot about the biology, but the social and cultural context matters too.
That's so true. Stigma is a huge barrier for people seeking help and sticking with treatment, especially for mental health. We definitely got to be mindful of that as therapists.
For sure. It's about creating a safe space for our clients to talk about their experiences and, really explore their beliefs about medication without feeling ashamed.
Beautifully said. Well, I think this deep dive has been truly eye-opening. We've covered so much ground, from the tiniest molecules to those broader societal issues. It's given me a whole new appreciation for how complex this all is.
Yeah, same here. It's been an awesome journey. And the learning never really stops, right? So to all our listeners out there, I encourage you to keep digging deeper, asking questions, and, never stop learning about this field because it's constantly evolving.
Absolutely. And to everyone who joined us for this deep dive, thank you so much for listening. We hope you found it informative, thought-provoking, maybe even a little bit inspiring. Until next time, keep those brains buzzing and stay curious.